Welcome to the Vanderbilt Medical Center Education for Lung Transplant Evaluation. We are one of the nation's oldest lung transplant programs, performing our first heart and double lung transplant in 1987 and the first single lung transplant in Tennessee in 1990. Since the start of our program, we have performed over 700 life-saving lung transplants and over 20 heart and double lung transplants. Over the course of this presentation, I will introduce you to important members of our team and review features of the 4 aspects of the transplant process. They include process of evaluation, the waitlist period, the lung transplant surgery, and finally, the mandatory follow-up care required after lung transplantation. We are a multidisciplinary team that includes our transplant pulmonologists. They are medical doctors that receive highly specialized training in caring for patients during all aspects of lung transplant. Our pre-transplant coordinators are specially certified registered nurses who coordinate the care of patients as they go through the evaluation process. Additionally, they coordinate the care of patients who await transplant on our UNOS waitlist to ensure you are always ready for lung transplant. Our cardiothoracic surgeons have received specialized and extensive training in all aspects of surgical care for patients undergoing lung transplant. Our surgeons are also trained to perform other surgeries that lung transplant recipients may require. Our program has a transplant surgeon, pulmonologist, and transplant coordinator on call 24 hours a day, 7 days a week to provide care and access to transplant for patients on our lung transplant wait list. Our patient care coordinators are often who you will speak to the most. They assist us in scheduling your testing, office visits, obtaining your medical records, and ensuring that you receive all the information you will need for your appointments both before and after transplant. You will meet our inpatient nurse practitioners once you are admitted to the hospital for transplant, and sometimes prior to transplant if you require an admission. These nurse practitioners assist our doctors in caring for you while you are in the hospital, both before and after transplant. After transplant, our inpatient nurse practitioners will collaborate with the pulmonologist for your follow-up care. You will also be assigned a new nurse coordinator after transplant who will be your main point of contact for any follow-up needs. Additionally, your lung transplant team at Vanderbilt also includes a dedicated transplant social worker, financial coordinator, transplant psychiatric providers, pharmacists, dietitians, and LPNs. The process of qualifying for a transplant has many steps, but you are well on your way. After you complete this education, you will move on to your evaluation testing. Once testing and consults are complete, you will meet with one of our transplant pulmonologists as well as one of our surgeons to review your testing results. You will then be presented at our weekly selection meeting. This is held every Friday and is attended by all of the essential members of our team. Once presented, you will be notified of the committee's decision by phone by your transplant coordinator or one of our physicians. Possible committee decisions will be discussed later in this presentation. If you are a transplant candidate, after you are placed in the wait list, you will follow up in our clinic every 4 to 6 weeks, or more often if needed. This is determined by the severity of your illness. These visits are very important as they help us monitor any changes in your illness. It also provides us with vital testing results that may change your place on the wait list. In order to be a candidate for lung transplant at Vanderbilt, You must have an advanced lung disease with a predicted high chance of death if you do not undergo lung transplant. You may also have a lung disease, which severely reduces your quality of life, which cannot be managed further with medications or alternative treatments or surgeries. To be approved for transplantation, you must be healthy enough to undergo the transplant surgery. In order to have the best outcomes with surgery, potential candidates are required to participate in pulmonary rehab at least 2 days a week while waiting for transplant. Candidates must be willing to take medications without fail for the rest of their lives to prevent rejection of their transplanted lung. Candidates must also follow all instructions for care and medical recommendations by the transplant team. Other requirements for lung transplant include having a healthy body mass index, or BMI. This is a measurement that takes into account your height and weight. We require a BMI of at least 17 and no greater than 35 for transplant listing. If your BMI is on the upper limits of this range, ideally it is safest for your BMI to be less than 30 for transplant. Additionally, you must not consume alcohol or illicit drugs now and after transplant. You must abstain from using nicotine in all its forms or using products that contain nicotine before transplant and for the rest of your life. You must also avoid certain medications like narcotics for pain, benzodiazepines for anxiety, muscle relaxants, and certain sedatives before and after transplant, unless they are prescribed to you by the transplant team. Your blood and urine will be tested at random before transplant for these agents. If your test results are positive for any of these substances, your evaluation may be terminated and your listing status at Vanderbilt reevaluated. Other requirements for transplant listing include having at least 2 dedicated caregivers to help you through the evaluation process while you are on the wait list, as well as after transplant when they must assist with your care. Please know that if you live greater than a 6-hour drive away from Vanderbilt, you will be required to arrange a medical transport flight to safely get you to Vanderbilt in a timely manner at the time of your organ offer. You would need to acquire this flight plan through a medical flight operator after you have been accepted as a candidate for listing, but before listing on our lung transplant wait list. Our social worker will help you find a flight program if it's needed. We are continually reevaluating contraindications to lung transplant to make it more accessible here at Vanderbilt. Some reasons for decline of lung transplant listing at our center are as follows: having significant heart, liver, or kidney disease, unless you are able to be considered for dual organ transplant, having cancer, having other infections such as HIV, hepatitis B, hepatitis C, and certain types of lung infections, being morbidly obese with a BMI greater than 35, having a substance abuse disorder, not having adequate social support, or not being able to follow the medical recommendations of the team would also make you not a candidate at our center. Before moving forward, it is important that we reiterate the risk of transplant and the lifestyle changes that you're expected to follow after transplant. This will help you to understand what is required to best maintain a healthy transplanted organ. There are many risks that come with lung transplantation. These risks include, but are not limited to, interrupted surgery, anesthesia risk, postoperative pain, risk of nerve damage, risk of infection, donor disease transmission, rejection of the lung, bleeding, blood clots, medication side effects, risk to the fetus if you're a woman who becomes pregnant while taking CellCept, cancer, psychological risk, financial risk, and death. Financial risks may result from the cost of transplant, medications, and follow-up care, which can be expensive. Additionally, you could lose benefits such as disability, Medicare, or Medicaid. Remember, our financial coordinator and our social worker may be able to assist you through these financial changes. Since donated lungs come from another person, No organ transplant is free of the risk of infection or disease that may be transmittable to you. All organ donors are tested for transmittable infections such as HIV, hepatitis B, and hepatitis C. The risk of catching one of these infections from a donor is very rare. At the time your organ is being offered to you, the transplant team will tell you if the donor may have had a risk of exposure the testing might have missed. After transplant, all organ transplant recipients at Vanderbilt have their blood screened for HIV, hepatitis B, and hepatitis C about 1 to 2 months after transplant. Know that if you contract any of these infections anytime after your transplant, your situation may be complicated by the medications you take to prevent rejection. The medications that you are required to take after transplant, unfortunately, have several significant side effects that can occur. The medications that help to keep your new lungs healthy can cause multiple diseases, including kidney failure, diabetes, and/or cancer. To help catch these complications early, it is important that you follow the directions of the team, keep your follow-up appointments, and stay up to date with all recommended screenings. The first year after transplant poses the highest risk for rejection and infection for transplant recipients. For the rest of your life after transplant, you must wear a blue surgical mask when visiting any medical clinics or hospital settings. Avoidance of large crowds is recommended during the first year, but remember to use caution even after the first year. Please remember to keep your hands clean, especially after touching doorknobs, handrails, or elevator buttons. Also, avoid friends and family who are infected with respiratory infections. Remember, you can get sick by consuming raw or undercooked foods. You can also become sick if you drink untreated and untested well water. If you sustain a wound, please be sure to keep it clean and free from infection. After transplant, because of the medications you will be taking to suppress your immune system, you are at increased risk of developing skin cancer. We recommend that patients perform a monthly skin check. It is important to note any changing skin or moles and to let our team know. It is also important that you establish care with a dermatologist and see them once or twice a year for a formal skin assessment as recommended. Transplant patients are 65 times more likely to develop some form of skin cancer. Because of this, it is important to take appropriate preventative steps, which include sun protection and surveillance. Sun protection is the best strategy to prevent skin cancer, and early diagnosis of skin cancer can save lives. We recommend that you cover up by using wide-brimmed hats and UV protective clothing when out in the sun. Additionally, generously apply sunscreen with an SPF of at least 30 when out in the sun. Remember to reapply when you sweat or get wet. If you have been diagnosed with skin cancer in the past or you are at a particularly high risk for it after transplant, please see your dermatologist for a full body assessment at least every 6 months. On this slide, you will see the hallmark signs of skin cancer. Moles that are concerning for skin cancer include ones that are asymmetrical, have uneven borders, are multiple colors, or are larger than 1/4 of an inch. It is important that you and your caregivers keep an eye on any moles and take notice of any changes in size, shape, and color. Any concerns should be addressed with your primary care doctor or your dermatologist. After transplant, you're at a higher risk of developing anxiety and depression. This can be due to medication side effects, hormonal shifts, or stress. Having depression and/or anxiety after transplant is common, even if you have never dealt with these feelings previously. Our post coordinators and psychiatric team are here to help and can assist if this does occur. When possible, obtaining a therapist or psychiatrist prior to transplant can be helpful. It can be easier to work through your anxiety and depression if you're already familiar with a provider. Due to the stress of transplant, new medications, and unfamiliar surroundings, some patients will experience a period of confusion while they are hospitalized. This is not uncommon, but can be scary for both the patient and their caregivers. Sometimes we can correct these symptoms with medication changes, but often they resolve on their own with time. Participating in the transplant process as a caregiver can also be very stressful. It is not uncommon for caregivers to struggle with maintaining their mental health. It can also be difficult on the relationship between the caregiver and the patient. Please do not hesitate to reach out to your coordinator for assistance with any mental health resources that may be needed during the process. While many of us have experienced some form of depression or anxiety in the past, lasting symptoms may need medical management or assistance from a therapist. Some common symptoms of depression, anxiety, PTSD, and delirium are listed here. Oftentimes, it is our caregivers or loved ones who notice these changes first. As a caregiver, if you are worried about the patient or feel they may be suffering with some of these symptoms, please feel free to make our team aware so that we can best assist the patient. In addition to being willing to accept the risk of transplant, patients must also be willing to make some dietary and lifestyle changes that will help maintain healthy lungs. The following is an overview of common lifestyle changes. These restrictions will be discussed again with you after transplant. There are a few dietary restrictions after transplant. It's important to make sure that all your fruits and vegetables are thoroughly washed with soap and water or a veggie wash. The outside of fruits and vegetables can contain pesticides and bacteria, so it's important that everything is cleaned prior to eating. All meats need to be cooked well done without pink centers. If you eat deli meats, your meat must be microwaved until it is steaming to make sure any potential bacteria is killed. After opening, deli meats are only good for 3 days. In regard to eggs, no runny yolks are allowed. Only scrambled and fried eggs are recommended. It is also important to avoid eating or drinking anything with grapefruit, pomegranate, or blood oranges. We also recommend avoiding herbal and green teas. All of these will interact with your medications, in particular Prograf or tacrolimus. These ingredients can be in a lot of food and drinks that you may not be aware of. Now is a good time to start reading the ingredient labels to see if these are in your food and drink. More information can be found on page 40 of your blue binder, which you will receive once you are placed on our wait list. After transplant, you need to be generally cautious and do your best to avoid illness. You should not visit with any small children for at least 3 months after transplant. You should also avoid babies or children around the times that they have received their vaccinations. You must also avoid contact with anyone while they are sick or have symptoms of an illness. Transplant patients are required to wear a surgical mask for the rest of their life when they are out in public. If you are leaving your home, we request that you wear a mask. Other areas where we need to be mindful are pets. Dogs and cats can stay in your home, but they need to be up to date on all their vaccines. Transplant recipients must also avoid animal scratches and bites. If you're scratched or bit by an animal, please wash the wound immediately with soap and water and apply antiseptic ointment. If you need to seek urgent medical care to attend to the wound, please be sure to inform the emergency provider that you have received an organ transplant. If you're considering adding a new pet to your family, we ask that you wait until 1 year after transplant. With any pet, be mindful of scratching as this is an avenue for potential infections. Birds are also not recommended for post-lung transplant patients. Patients must take precautions not to change cat or small rodent litter, clean bird cages, go into chicken coops, or clean fish or reptile tanks. All of these activities increase the patient's risk of infections. These infections can be deadly to a person with a weakened immune system. Some common hobbies will also need modifications after transplant surgery. We do not recommend swimming in any bodies of water or swimming pools for the first year. After the first year, you can swim, but you should not submerge your head underwater. This is a lifelong practice. This is so you do not accidentally get contaminated water into your new lungs. If you like to garden, we also request that you wear both masks and gloves when gardening. If you hunt, please do not field dress or skin animals in the wild. If you fish, do not bait your own fish hook or dehook your caught fish, and please do not clean your own fish. It's also important to remember that mosquitoes and ticks can also transmit deadly infections. Use repellents and avoid times such as dawn and dusk to be out when these critters are more likely to be active. Before proceeding with evaluation testing for transplant, patients should understand the basics of organ rejection. We talk to our patients about rejection because it is very common and is often misunderstood. Rejection is a scary word, but the best thing we can do is educate you and keep you informed. Rejection occurs when your body realizes that your lungs are foreign and begins to attack them. In order to prevent damage to your new lungs, rejection must be treated quickly when it does occur. Because of this, you'll be receiving frequent bronchoscopies the first year after transplant. During these, we'll take small samples or biopsies of your lung tissue and do a test to check for signs of rejection. If your biopsies show rejection, we often start treating it with IV steroids and then an oral steroid taper. This means we'll start you on a high dose of steroids for 2 days and then slowly decrease it over 2 weeks. In order to help prevent rejection, you must take your medications as prescribed without fail. You must also notify your coordinator immediately if you have any flu-like symptoms, cough or chest pain, fatigue, fever, shortness of breath, decreased oxygen saturations, or decreased spirometry. When you are initially recovering from transplant, you will be on numerous medications to help prevent infections. Some of these medications will be stopped as you recover, but you will be on at least 3 new medications for the rest of your life. These medications include prednisone, Prograf or tacrolimus, and Cellcept or mycophenolate. These 3 medications are the backbone that helps us to prevent rejection. These medications are often referred to as anti-rejection medications or immunosuppressants. Missing any doses of these medications will significantly increase your risk of developing rejection. Unfortunately, anti-rejection drugs can have significant side effects. The most common side effects are listed on this slide. If you experience any of these from the medications, other similar medications can be considered. After this education, you will begin the process of being evaluated for lung transplant so we can determine if transplant will be a safe and beneficial option for you. As previously mentioned, the first step of the transplant process is education. In addition to reviewing this presentation, you and your caregivers will be expected to read and understand our educational book, Being Evaluated for Lung Transplant. The next step is that you will be scheduled at Vanderbilt University Medical Center for a comprehensive outpatient evaluation over several days where you will meet with various members of our team, undergo testing, and finally meet with one of our lung doctors to review your test results. The purpose of the evaluation is to continue to be educated about transplant and for us to determine if you are medically, surgically, emotionally, and mentally able to go through lung transplantation. Social support and your financial situation will also be considered as part of your overall readiness for lung transplant. During the evaluation, you must make arrangements to bring your own supply of portable oxygen and have a caregiver with you. You will also be required to make your own arrangements for lodging near Vanderbilt during your evaluation. Please note that appointments may be scheduled as early as 7 o'clock in the morning and as late as 6:30 in the evening. Here you can see a sample of how our evaluation testing itinerary is formatted. You will receive your itinerary via mail prior to your evaluation week. Our PCPC will also call you once it's complete and let you know what dates and times your testing is scheduled. You may see some of this testing within your MyHealth app, but not all of it will show up. Please use your itinerary as your main source. It is important that you do not cancel any of your appointments yourself. If you need to cancel anything, please contact the lung transplant office and speak with your coordinator. Some appointments can be very hard to reschedule, so it is important that you are able to make it to any and all appointments. The evaluation testing generally takes about 5 to 7 weekdays to complete. As we previously mentioned, towards the end of your evaluation testing, you will meet with one of our transplant pulmonologists as well as one of our surgeons to review your testing results. After these appointments, you will be presented at our next selection committee meeting, which occurs every Friday. After your information and testing results are presented at the selection committee, one of several decisions can be made. Possible decisions include approved, which means you meet the criteria for lung transplant listing at our center and are accepted for activation on our UNOS lung transplant waitlist. You may be too early, which may mean that we close your referral or simply follow up with you every few months to determine the progression of your illness and to determine appropriate timing for transplant. You may be placed as pending. That means that we anticipate that you will be approved for transplant, but we still need more items to be completed in order to give our final approval. We could need to represent your case. That means that we do not have enough information yet to make a decision. You will be notified of any additional testing or visits that need completed before we can review your case again. Or declined. If you are declined, this means that you do not meet our criteria for listing at our center. The committee has a responsibility to ensure the candidates with findings that would make transplant unsafe or those with findings that would not result in a better quality of life are not approved for transplant. During your office visit with our pulmonologist and surgeon, they will discuss the option of receiving different types of organs, including those infected with hepatitis B and hepatitis C. The first option available is to accept lungs from a donor who was previously infected with hepatitis B. The risk of you developing hepatitis B from the donor lungs is low, less than 3%. However, hepatitis B is not curable. So in the unlikely case that you would become infected with hepatitis B after transplant, an extra medication would be added to control the infection. You can also choose to accept lungs from a patient who is infected with hepatitis C. If you accept a hepatitis C infected lung, you are expected to become infected with hepatitis C. There are 4 different antiviral medications that can cure hep C with a greater than 95% cure rate. These medications are given and carried out for weeks after lung transplant. The Vanderbilt liver transplant team will be part of your care team as the experts regarding these antiviral medications and to help provide other treatment strategies should your infection not be cured. Accepting lungs from a hepatitis donor should increase your chances of receiving a lung transplant sooner compared to waiting for a non-hepatitis infected lung. Next, we will cover information about being placed on the wait list if approved for transplant, getting your transplant, and the plan for your follow-up care. However, before we proceed, we would like to take a few moments to answer any questions you may have up until this point and allow you to take a quick break if needed. If the selection committee has decided that you would be a good candidate for lung transplant, we will proceed with the process of getting you placed on the national wait list for transplant. Once you have been approved for transplant by our committee and your insurance authorizes the listing, we will call you to make sure you are ready to be activated on our transplant wait list. After you have been placed on the wait list, it is time to notify your caregivers, pack your bag, ensure your cell phones are charged, and be on call for that phone call offering you a lung transplant. There are more people waiting for transplants than there are donor lungs available. To make the allocation of available organs fair and equitable to those who need them, patients are listed on the National Registry through the OPTN, or Organ Procurement and Transplantation Network. The OPTN is run by UNOS, or the United Network for Organ Sharing. UNOS is a private, nonprofit organization that serves the nation's transplant system. We must provide certain demographic information at the time of listing to the OPTN, as well as information from your evaluation testing and updates on your progress at regular intervals from here on out. Lung transplantation becomes possible when a donor becomes brain dead, or in some cases, once the donor's heart has stopped beating. If the donor was a registered organ donor, or the donor family agreed to do so, the organs are matched for transplantation to potential recipients on the UNOS wait list. If accepted for transplant for one of our recipients, the organ is removed from the donor and transported back to our recipient, who is being prepared for surgery in our operating room. Coordination of the timing of these events is crucial for the success of your operation. We must mention that you may have the option to be evaluated and listed at multiple lung transplant centers to potentially decrease your wait time for matching lung offers. If you are currently listed at another transplant center, you have the option to transfer your wait times as well. Once listed on our lung transplant wait list, donor lungs are offered to match recipients based on the following criteria: the distance from the donor hospital, the composite allocation score, or CAS, blood type, size, and immunological compatibility. When lungs become available for transplant, a recipient on our wait list with compatible blood type and size of the donor with the highest CAS score will be offered the organ first. As I mentioned, lungs for transplant must come from a donor who has a compatible blood type. This chart shows donor blood types who are compatible with your own blood type. If you don't know your blood type, we will provide this information to you after you complete the lab work portion of your evaluation. If you are sensitized to antibodies to cell markers of a potential donor, we will avoid that transplant due to immunologic incompatibility, as it would lead to a hazardous form of rejection. If you have many antibodies, this may increase your wait time for a lung that your body's immune system would not aggressively reject. Your transplanted lung will never be accepted by your body's immune system, and for this reason, you must take immunosuppressant medication to weaken your body's immune system and prevent rejection. Rejection can and will happen if you do not regularly take your medicines after transplant. Rejection of the transplanted lung will lead to failure of the organ and to your death. The time you wait for an organ which matched to you will vary. There is no way for us to know when a compatible organ will become available to you. To make the distribution of available organs fair for candidates who need them the quickest, UNOS uses the Composite Allocation Score, or CAS, to ensure the sickest candidates have the highest priority when a donor lung becomes available. With the CAS system, the higher the number, the sicker you are, compared to your ability to also survive the surgery. This number is between 0 and 100 and is designated to you at the time of listing or with any updates. The average score is between 20 and 22. We update your CAS based on your lung disease, your current oxygen requirements, and your current test results. The CAS is updated at least every 2 months for most of our patients, but as frequently as every 28 days, depending on your oxygen needs. While you wait for lung transplant, you must keep your lung transplant coordinator updated with any changes to your contact information, including phone numbers and address changes. Additionally, you must let us know of any changes to your caregiver plan, to your health insurance, as well as any changes to your healthcare decisions. Please do not wait until your Thursday UNOS check-in to inform us of changes to your health, including visits to the urgent care, emergency room, or any hospital admissions. Additionally, it's important to let us know as soon as possible with any upcoming surgeries or procedures that you have scheduled. If the change is so important that it may affect your ability to receive a lung transplant, know that we have a transplant pulmonologist and transplant coordinator on call 24/7. To reach our team outside of regular business hours for emergencies only, please call our office number at 615-936-0393 and select option 2, which is for clinical concerns. You'll then be directed to our after-hours answering service, who will get you in touch with our lung transplant doctor on call. When you receive the call notifying you that a donor lung is available, you can be confident that our team has determined the organ is a good match for you. The surgery team will continue to monitor the donated lung and ensure that it remains in good condition before they proceed with surgery. Because the lungs are monitored so closely, we may find that the lung quality has decreased with time and is no longer suitable for transplant. This may mean that your transplant is canceled after you have already arrived to the hospital and have possibly already been prepped for surgery. In these cases, you will be discharged back home to wait for another organ offer. This is often referred to as a dry run. Finding an organ that is suitable for transplantation is difficult, and it is estimated that only 20% of available donor lungs are chosen to be transplanted into an awaiting patient. Once listed on the UNOS waitlist, you must answer any and all phone calls at all times. Unfortunately, the call with your organ offer may not come from a 615 area code. While you are on the wait list, you will need to return to the transplant clinic at least every 1 to 2 months, and your testing will be repeated. Remember that the time that you wait for an organ which matches you will vary. Again, there is no way for us to know when your matching organ will become available to you. While you're on the UNOS waitlist, we must know that you are ready for transplant at all times. We require you to check in with your pre-transplant nurse coordinator weekly while you're on the wait list. You'll be asked to provide answers to the listed questions. Remember that the time you wait for an organ will vary, and there is no way for us to know when a suitable organ will be available for you. Once you are on the wait list, you are ready to get your bags packed. Common items that patients like to bring include loose-fitting clothes, a robe, slippers or secure shoes, personal hygiene items such as a toothbrush, toothpaste, hair care, a laptop or tablet, phone chargers, and your blue educational binder that will be provided to you once you are placed on the wait list. Once you are placed on the lung transplant wait list, you are welcome to join our monthly support group. The support group is led by our social worker, Leslie, and allows you time to meet and chat with other lung transplant patients. Virtual sessions occur on the second Tuesday of every month at 12 p.m. Transplant education is provided each month, and a provider is often available at each session to answer questions. Ask your coordinator or our social worker, Leslie, for more information once you are listed. Many patients have also developed different Facebook groups and other support groups on their own. Please reach out for more information if you are interested. The next several slides will review the basics of the transplant surgery, as well as the recovery process. Once we are notified of the availability of a potential donor lung for transplant, we have 1 hour to respond to UNOS and answer on your behalf. If you do not respond to your organ offer call, we must move on to the next recipient on the wait list. Please plan to arrive quickly and safely to Vanderbilt. Do not eat or drink anything after you receive the call, and do not take your blood thinning medications if you are prescribed one. You can expect a single lung transplant operation to take 4 to 6 hours, and a double lung transplant operation to take 6 to 8 hours. Over the next few slides, I will briefly discuss with you the different surgical options and show images that may be of a sensitive nature. In this slide, you can see a lung that has been placed on a lung pump. This can be called EVLP, a boxed or pumped lung. Vanderbilt Transplant utilizes a lung pump as needed, and you may hear it mentioned by your team. This is a process that allows the lungs to be kept outside of the body for a longer period of time, giving the surgeons more time to evaluate the donor lung and ensure it meets our criteria for transplantation. The pump can also be used in order to allow us to have more travel time between the donor and the recipient if needed. The use of this pump can extend the period of time the lung is outside of the body from 4 to 6 hours without a pump to up to 20 hours when we utilize the pump. This is an image of a recipient who received a clamshell incision for a double lung transplant. You'll notice the staples running across the recipient's chest towards the top of the image. You will also notice the sites around the recipient's side with single stitches, also known as sutures. This is where chest tubes were previously located but have now been removed. Chest tubes are inserted at the time of surgery to remove air and fluid from the space around the lungs to allow proper inflation of your new lungs. Chest tubes will be removed after transplant, usually within 3 to 5 days after surgery, or when the medical team feels it is safe to do so. The sutures close up the chest tube insertion sites and will be removed along with the staples when the wound safely heals, or around 6 weeks. Here is an image of a recipient who underwent a lateral incision for a single left lung transplant. Your surgeon may opt to perform lateral incisions on both sides if you're a candidate for a double lung transplant instead of the clamshell incision on the previous slide. The surgical approach, as well as surgical risk for transplant, will be more thoroughly reviewed with you when you meet with one of our surgeons during evaluation. The decision for listing for single or double lung transplant is made as a team at our selection committee. Sometimes the decision is made that you could benefit from either a single or a double lung transplant. In that case, you will be listed for both. The decision for a single or double lung transplant is based on your anatomy, your lung disease, certain features of your medical condition, and your medical history. If you are eligible for both a single or a double lung transplant, you will know exactly what organ you are going to receive when you are contacted with the donor lung offer. When you are called in for transplant, you will be admitted to the cardiovascular ICU, also known as the CVICU. This is where you will be prepped for surgery and where your family will wait while you have your transplant. Once the surgery is complete, you will return to the same room. When you first wake up, you will have several tubes and drains in place. You will initially still have your breathing tube, and you will be restrained to the bed in order to prevent injury. This is completely normal, but can be scary when you first wake up. While in the ICU, you will be under close monitoring, and it may be hard for you and your family to get any consistent sleep. While we want your family members to be present, we do encourage them to go back to the hotel room from time to time in order to get better rest. Remember that one of the goals is to manage your pain after transplant so that you may continue to strengthen after your surgery. We employ different strategies to do this. pain control is especially important so you can complete your hourly breathing exercises and continue walking. While in the ICU, you may also require the use of an ECMO machine, also known as an extracorporeal membrane oxygenation machine. This machine is used after your transplant if your new lungs need a little additional help while they adjust to your body. Not every patient will need ECMO after surgery, but if you do, it is not uncommon. You may wake up from surgery on ECMO, or it may be added later if needed. It is discontinued once your new lung is working more effectively. ECMO helps give the lungs a chance to recover by assisting them in removing the carbon dioxide from your blood and sending oxygenated blood back to your body. After you recover enough to leave the ICU, you will be moved to our transplant floor. Once you are out of the ICU, you and your caregivers will be ready to learn more about your transplant and your medications. You will meet your post-transplant coordinator and receive more specific transplant education about your specific care. You will be able to get more rest once you are out of the ICU, but you will still have early morning labs and chest x-rays, as well as someone checking your vital signs around the clock. Your total stay in the hospital is estimated to be a little over 2 weeks. Sometimes patients are also recommended to be transferred to our inpatient rehab hospital to get as strong as possible before discharge. After surgery, you will need to be careful how you get in and out of bed. These handouts will be provided to you in your post-transplant binder, but it is important that you know ahead of time that you will need to use extra precautions after your transplant surgery. After your hospitalization, you will require close continued care with our team. You will hear a lot of this information again when you complete your education after transplant. This general overview is provided in order to help you better understand the expectations after transplant and how busy the recovery process can be. Once you are discharged from the hospital, you and your caregivers will be required to stay within 45 minutes of Vanderbilt for at least 3 months. This timing will depend on how well you do after surgery, and if you have had any complications during surgery or your recovery, you may be required to stay close longer than 3 months. During this time, you will have frequent clinic visits to monitor your health and the health of your new organ. You'll have lab draws, sometimes as frequent as 2 times a week, and you will undergo other testing, such as pulmonary function tests and chest x-rays. You will also be required to participate in pulmonary rehab at Diani multiple times a week during this time. If you are determined to need more physical assistance after your transplant recovery, you may be required to go to our inpatient rehab facility. This facility, Stallworth, is located on the Vanderbilt Medical Campus. This is often used to help you build up your strength before you go home, or to your local housing if you live greater than 30 miles from Vanderbilt. This will extend the time you are required to stay in Nashville. You will still need to stay in Nashville for 3 months after you leave inpatient rehab. This is most often used when you have a long recovery after transplant, but can be needed for anyone. The first 3 months after transplant are the most difficult for patients and their caregivers. It can be challenging to keep track of all the medications, testing, and appointments. Your post-transplant coordinator will help you navigate this process. During the first month or 2 after transplant, you will be seen in clinic weekly. After this time, you'll be seen every 2 weeks and then monthly. The frequency of your visits is going to vary depending on how well you're recovering. This will be determined by the transplant pulmonologist at the time of each appointment. During each visit, you'll be scheduled for a chest x-ray, formal spirometry, and labs. Your labs will be looking at your blood counts, kidney function, electrolytes, and your immunosuppression levels. In order to get accurate results, it is important for you to hold your medications prior to getting your labs drawn. We recommend bringing a snack and your morning medications to your lab visit so that you can take them after you have had your labs drawn. After the first 3 months, the number of visits to our clinic will occur less often. It is still important to note that during this time, bronchoscopies will still be required at 6 months, 9 months, and 1 year after transplant. You will also be required to come to the clinic monthly during the first year after transplant. If you become sick or have complications, your visits may be more frequent. As previously mentioned, you will have frequent bronchoscopies, or bronchs, during your first year after transplant. Bronchoscopies are outpatient procedures where the lung doctor will provide you medication to keep you comfortable before placing a tube into your airways to examine your transplanted lungs from the inside. The doctors will take samples of your sputum as well as pieces of your transplanted lung. They do this to determine if you have any infection in your airways as well as to determine if you have any rejection of your new lungs. The reason bronchoscopies are so important is because sometimes you may not have clear symptoms of rejection. Doing these biopsies will help us to know about rejection sooner, and that way we can treat it sooner. You can expect to have a bronch every 3 months during your first year after transplant. After the first year, you have a bronch yearly until you're 2 years post-transplant, and then you will only need a bronch as needed, determined by your doctor. If your bronch shows rejection, you'll need 2 follow-up bronchs, 4 to 6 weeks after treatment, to evaluate if the rejection is still present. The transplant process can be long and complicated, so caregivers are very important, both now and during your recovery. In order to be a caregiver, individuals must meet certain requirements. Caregivers must be able to read and write and follow directions. They must be able to drive you to and from your appointments when you are not medically safe to do so. And one of them must be able to stay with you during the post-transplant period of at least 3 months after discharge from the hospital, which is 24 hours a day, 7 days a week, for 3 months after discharge. During the evaluation process, your caregivers must attend this education session in order to understand the basic concepts of transplant process. We also request that you have one of your caregivers present with you for all evaluation testing. However, if needed, an additional caregiver outside of your primary and secondary caregiver can also be present with you. Caregivers can be helpful during the evaluation testing to assist with the transport of oxygen, as well as to serve as an extra set of ears to help you retain information about your testing and results. After your transplant is complete and you are well enough to move out of the ICU, caregivers become very important. As we said, once you're moved out of the ICU, you will meet your post-transplant coordinator and teaching will begin. It is very important that your caregivers are present during this time. They will need to learn about your medications and how to care for you once you are discharged. It is important that your caregivers are familiar with how your recovery process is going. This will help them to better care for you once you leave the hospital. The more familiar they are with your vital signs, activity level, and medications, the better. Caring for a loved one after transplant can be very stressful. Please consider that as a caregiver, you may be very stressed during this time period. Caregivers may also not be able to get a lot of regular sleep while the patient is in the hospital. The needs of the patient come first, and that often means being awakened often so that the staff can closely monitor your loved one. During the first 3 months out of the hospital, the caregiver is responsible for staying with the patient 24/7. Caregivers should expect to help with grocery shopping, driving the patient to clinic visits and rehab visits, picking up medications, and assisting the patient with daily personal care, as well as helping them to communicate with their coordinator for any needs or concerns. During this period, the patient should not be left alone for any significant amount of time, generally no longer than a couple of hours at a time. In order to help your evaluation for transplant run smoothly, our Vanderbilt Transplant team strongly recommends that you upload our app to your phone or tablet if available. Our app allows us to communicate directly with you about your appointments, test results, and medication changes. It also provides an easy and direct way for you to message our team with any non-urgent questions you may have during the process. We appreciate you seeking lung transplant at Vanderbilt University Medical Center. Please refer to our SRTR data sheet for graft and patient survival statistics at Vanderbilt after lung transplant. The Vanderbilt Medical Center will notify all patients on our waitlist if we are ever unable to provide transplantation services in the future. We are currently a Medicare-approved facility and do not anticipate this to change. It is important to note, though, that your prescription drug coverage may be affected if our Medicare transplant status changes. Transplant is a big commitment before and after. Please refer to the resources listed on this page for additional information. Please visit our website for additional information about lung transplant at Vanderbilt University Medical Center. Thank you for your attention, time, and trust. We look forward to seeing you at Vanderbilt.